Welcome everyone to the third in the International Academy of CIO series on technology and country responses to coronavirus. Today we're going to be focusing on Thailand, following on to the first two on Taiwan and Andhra Pradesh. Have a wonderful set of speakers today from the Thailand government as well as from Thammasat University. And the event is co-hosted by Thailand's NECTEC, National Electronics Computer Technology Center, which is part of NSTDA, National Science and Technology Development Agency, as well as the College of Innovation at Thammasat University, and a relatively new Thammasat University Artificial Intelligence Center. So thank you for all the wonderful speakers. And we're going to be starting today and tonight with Ms. Wantanee Phantachat, the Executive Director, Assistive Medical Devices Research Center at the International Academy of CIO. We've been working with NECTEC and NSTDA and Thammasat University for about 15 years now. So welcome and thank you very much, Director Wantanee.
Hello. Yeah. Should I start now?
Yes, please.
Yes. Okay. Phanpom, could you put my slide on?
Yes.
Okay.
Please proceed.
Yes.
Thank
you. Thank you. Hello, everybody. Greeting from Thailand. Today, I will talk about the innovation research for COVID-19 in Thailand. As you know, that the situation of COVID-19 pandemics affect all over the world. In the case of Thailand, it starts on January with the case of the tourists, and then it quite infected by Thai people during March. At that time, we are trying to do everything to help the country as we are the research organization. Next, please. This is the situation from January. I got the last statistic in the 5th of August 2020. If you see the case in Thailand, it's confirmed as the coronavirus is only 3,328 that confirmed cases, and we have people who are recovered 3,144, and it is in hospital around 126 and 58 deaths. So this is a situation which is also quite handled now. Only the people in the that comes from other countries and have to go into the state quarantine that have infected the COVID-19. Next, please. At that time, you know that we are very worried of the situation as it's people infect a lot in March, during the mid of the March, and then there are many people goes to hospitals. And at that time, we know that we are very small country. We didn't produce the medical device. We import all the medical device from other countries. So at that time, as a research organization, then we try to help the country. So our organizations called NSTDA, National Science and Technology Development Agency, appointed the technical and academic committee to handle the innovations to support and solve the COVID-19 management. Professor Dr. Phantachat, he is very leading of the IT people, and now he is doing his research on the medical device. He is kindly chair the committee with the advisor of 4 deans of medical schools in Thailand. We have Mahidol University, Chiang Mai University, Prince Songkla Universities, and Thammasat University that help us and give the advice to our researcher. So at that time, from March, many researchers have to try to do anything that using their expertise to produce or develop some products that needs by the medical doctors. So at that time, now we collect, up to now, we collect 30 innovations from our researchers and partners who develop the medical device or necessary device to support the COVID-19 management. So next, please. I would like to share with you that these are, I will give you the example of our innovation that we can do it in like 1 month or 2 months to help the people. The first one I would like to share you is the application called DDC Care. This application is application for tracking patient under investigate. This is a project that collaboration with the Department of Disease Control in Thailand. So we use this application to all over Thailand to tracking the PUI to help the doctors. So this is still using in Thailand. The next one, the second one is we call NIAMS Care. NIAMS Care is also the application that we collaborate with the National Institute of Medical Emergency System. So this application is used in the community. It is a self-report from the every family to the local government in the community. So, and then they have a network to investigate all the people in the community. This is used around 12 communities in Thailand. And if you see that the screen of the application, so you will know that each house are green or yellow or orange or red, and then the medical doctor can investigate that house. Next, please. Another 2 products from our researchers are the mask, the surgical mask or hygienic mask, which can protect PM 2.5 bacteria and virus. The number 3, using nanotechnology. And number 4, using the hydroxyapatite and titanium dioxide to kill virus. And these 2 masks were sent to the Nelson lab in USA to prove that it's killed virus 99%. Next, please. Number 5, we collaborate with the the company called the NECTEC to develop the medical device demand and supply matching platform for COVID-19. This web application or platform is used to match the demand from the hospital and supply from the people who want to donate something to the hospital. So we use the digital platform for matching the demand and supply. The next one is also from our partners, NECTEC company. Then they donate the robot called the Happy Bot. The Happy Bot is using the technology that can provide the good solution of automated guided vehicles. This robot can go everywhere without the fixed map. So it can use in the hospital. Now we provide these robots to 10 hospitals in Thailand. Next, please. Number 7, this is also that our researchers collaborate with one company called Silicon Craft Company. We use the wristband to help tracking people in COVID-19 situation, and we pair the wristband with our application DDC Care to make the person identification, and this is also used under the Department of Disease Control for the home quarantine or state quarantine, that we know the people go anywhere. The next one, number 8, is also we got the company produce also the mask to the all organizations that have essential needs. Next, please. Number 9. Number 9 is from my laboratory. As in my laboratory, one of my laboratory called the image processing laboratory, we are develop the mobile X-ray and chest X-ray. So we give the these 2 X-rays to the hospital to use with the patient under investigate. We provide to Thammasat University and another one in the Ramathipadi hospitals. The next one, number 10. Number 10 is also the example that we can develop this germ saver robot in only 1 month. Is a robotic germ sterilization by using UVC to killing all germs. And this also used in the big exhibition company. Next one. Next, please. Number 11 is a new term. You will listen to the next speaker. I won't touch this product much because you will hear more from Dr. Sarun. Number 12. Number 12 is a negative pressure patient isolation. So we got the this problem to solve the problem to transport the people. So we design it and develop it in NSTDA. Now it is in testing the standardization. So this is all our effort to help the Thailand situation. Next, please. So I would like to thank all the researchers to put hand together, and this is shows that the researchers can help people, and I think this is happens the same here in the whole world. Thank you.
Thank you very much, Director Wantanee, for the background on all of NASDA and NECTEC's efforts in Thailand over the recent months. And then our next speaker is Dr. Sarun, who's going to go into a little bit more depth on the thermal face sense technology.
Okay, good morning and also good night in Thailand. I just would like to represent my research team to introduce you about our work called Midterm Phase Sense, which relates to the smart temperature measurement. My teams are myself and also Mr. Amod Sombunkel, and the last one is Silajit Wuttiwong. These are three key persons, and we have more than 15 people involving in this project. And again, I'm from NECTEC NASDA in Thailand. So next slide, please. The scope of my talk will cover just 4 items briefly. One is from COVID-19 to tech prototype at NASDA. And the next one will just give you some history about the infrared technology for fever screening, and then move on to our development of real-term phase sense and wrap up with the current status. Next, please. Ms. Wantanee already mentioned to you about some technology prototype development at NASDA. For this slide, I will just focus on the human temperature screening highlighted in yellow here. As you can see from the left-hand side, which is the daily new cases in Thailand, updated last week, just to show you that since the COVID-19 started to appear in Thailand, we immediately move on the 2nd of March to start speeding up the development of our prototype, which at the end come up with the picture shown in the right-hand side, and I will give you more detail in the following. Next slide, please. Why we use the infrared technology? I think everyone know that this technology is very popular now and widely accepted for mass human temperature screening. Why? Because it is fast, passive, non-contact, and also it is a non-invasive approach. Next, please. And you know that it's not new for this infrared technology or infrared thermography. Since 400 BC, temperature has been used for clinical diagnosis. And thermometer was developed in the 17th century. Even Galileo itself, he discovered the principle of and invented the thermoscope. And in 1800, Sir William Herschel discovered the infrared radiation from sunlight, and his son recorded the first thermal image as shown on the right corner bottom. Next, please. And there are many theories developed by very well-known scientists, as you can see from this slide. But the key idea is human skin temperature lies within the wavelength of 2 to 25 micrometer, and its peak around 8 to 10 micron. And this is very important because the spectral band from the current detector, infrared detector, which we call bolometer, respond very good or very well in the region of 8 to 12 micrometer for human temperature measurement. Next, please. And I think the important thing is the microbolometer was developed in 1980s. And this is a very important. Without microbolometer, we will not have a very fast and accepted accuracy for the fever screening system today. Next, please. This slide just shows you the timeline of the development of mass human temperature screening in Thailand. We actually began in 2007 or 13 years ago. At that time, you can see that on the left-hand side, we have a big camera, thermal imaging camera, which was very expensive. The only thing that we could do at that time is we developed the software as shown on the left-hand side, where we have the face detection. We apply the compensation algorithm to compensate for the environmental fluctuation. And also, after we detect the face of each person in the field of view of the thermal imaging camera, we can simultaneously determine the temperature of each person. And then after the time gone by, the electronics got cheaper. And also it helped us to write the program easily. So in 2015, the FLIR company came up with the FLIR one that you can use with your mobile phone. So we started to move into that module to develop the software. And again, applying the same concept, detect the faces, and then for each face, try to determine the person's temperature. I think the breakthrough came out in 2018, where we put more sensors, and we also embedded with a big screen, and we also got a medal silver from the International Exhibition of Invention in Geneva. We tested our prototype at the Thammasat University Hospital nearby our research institute, and also tested the prototype at the prison and correctional facility nearby our research institute. And then we move on to 2019 and 2020 today, where we engineer and improve the prototype developed in 2018 in order to improve the algorithms for the compensation and also embedded LiDAR into the module. So next, please. For the prototype in 2018, we also submitted our work to this journal Applied Optics. It got accepted. And in this version, we have the sensitivity of 100%, specificity of 92%, and also accuracy of about 92%. So next, please. So this slide shows you the current version, 2020. The additional things that we also do for this prototype is we got it tested for the important international standards. As you can see from the lower left corner, that this prototype passed two standards, international standard. One is the IEC standard for the electrical safety requirement, and another one is the international standard for electromagnetic compatibilities. We also got the certificate of calibration thermographic instrument from the National Institute of Meteorology. So next, please. And last week, the IEEE Spectrum also published this news from our work titled "This Temperature Screening System for COVID-19 can check up to 9 people at once." And it shows our current prototype. So next, please. Currently, we have deployed 40 sets of our build-term flatten inside our research institute, NSTDA, NECTEC, in hospitals, prison and correction facilities, and also public transport services. Currently, we are opening for pre-ordering for additional 40 sets in order to support the current needs from the government organization and also the private companies. And at the same time, the technology transfer department are in the process of discussion with the local tech companies in order to transfer our technology to the private company for commercialization, so that we can move on to do some other research topics. So with this, thank you very much.
Thank you very much, Dr. Sarun, and fantastic research and beginning to commercialization and deployment and much recognition. Thank you. Our next speaker is Dr. Ananlada, who's going to be discussing another innovation from NSTDA, DDC Care, a tracking system for people who may be infected by COVID. So Dr. Ananlada, please.
Hello, everyone. So this research work is done with another two researchers, Dr. Nathanan Thakpitakul and Dr. Nayana Saveshpan, and also there are like almost 20 programmer to help doing this project. And this work is in collaboration with the Department of Disease Control, Ministry of Public Health. Actually, the name DDC Care is come from the Department of Disease Control, and we hope that in the future, the DDC Care can be the general platform to help the Department of Disease Control to cope with maybe in the future, if we have another outbreak, we can still use this platform to monitor and control the disease. May I have the next slide? So actually, this project started in around the end of February. And as you may know that we found the first case of COVID-19 in Thailand since in January, but it's not. It didn't worry us much until in February when we got more number of local transmission, and also there are many cases in many countries in Asia. So at that time, people start to get worried, and we get a chance to meet with the health worker from the Department of Disease Control, and they are looking for the tool that help them to monitor and tracking people who are at risk of getting the COVID-19. So, for example, people who come back from a country that have an outbreak, or people who are the close contact of the patient who was already identified as getting positive for COVID-19. And they told us that there are two requirements for them for this monitor and tracking system. So the first one, that they need to monitor the health condition of the people who are at risk for 14 days. The second one is they need to know the location for the first case. If this person have to be in home quarantine, they would like to make sure that they are compliant with the regulation that they stay at home all the time for 14 days. And for other cases, they would like to know if this person travel and afterward become infected. They would like to know the where they go, so that the Department of the Disease Control can be able to identify the close contact of this person. And this is also another additional system requirement that because we are in such a hurry of getting the outbreak in Thailand back in February, the system should be available within a couple of weeks. And then they said that for the worst case situation, the system must be able to accommodate up to 500,000 users. That's quite been a shocking number for me at the first time, because we have to make a system that have a scalability enough to accommodate that much number of users, and we are worried about this situation quite a lot. Okay, next slide, please. So the system, we developed this system to help the healthcare worker to reduce the workload when they have to monitor and tracking the people who have risk of getting COVID-19. And the system consists of three parts. This first one we call the DGC care registry. So this component is we implement as a web page that people who can use the system must register first whether using the QR codes or SMS. So we need a registration because we would like to screen that the people who actually use the system and putting the input into the system is the real person that we really need to monitor. We don't want people to randomly download the application and enter the information. And so that would increase the workload of the healthcare personnel. The second component is the DGC Care mobile app, which we use the mobile application because it's I think more than 80% of the people in Thailand have a smartphone, and then we can automatically retrieve the user location using the GPS module on the mobile phone. And the last one will be called the DTC Care Dashboard. It's a web application that all the data that come from the mobile application is visualized on the web, and the healthcare personnel can look at the data and can do the modeling from the website. So let me go into the detail in the next slide. We have next slide. So this is the use case scenario. So when the patient come to the hospital, if the result of the COVID testing is negative, we will ask them to stay at home to do a home quarantine for another 14 days. So they have to scan the QR code during the registration and then download the app. And if for the person who get the result as positive, this person does get into the system because they have to stay at the hospital, but the post contact the family, the relative, and maybe someone who work with them need to be in quarantine. So instead of asking them to come to the hospital, we send them the SMS. They will get it on their mobile phone, and then they can do the registration, and the process goes the same for the people who get registration through the QR code. And after they install the app, they identify the home quarantine location, and then do the self-screening to report their health condition for 14 days. And all the data go to the dashboard. We have the healthcare person from the hospital to help monitor their health condition, whether they are getting the fever or not. And also we have what we call the provincial or district health officer who also monitor the person who are getting quarantine at each province in Thailand. May I have next slide, please? So I will go into detail for the first component of the system, the registration. So we use two verification technique that to help us screen the people who get the person who actually be specified by the healthcare person as people at risk. So for the QR code, it's going to be automatically refreshed every 30 minutes to prevent from the QR code duplication. So if someone would just taking the photo of QR code and send it to his friend, it won't be able to get the registration because it will be expired. And for the SMS link, it's going to contain the verification information, which is the ID number and the mobile phone number. You have to enter the correct number that associated with the link in order to get the registration. Next slide, please. So for the DDC Care application is available on both the iOS and Android, and now it supports 4 languages, Thai, English, Chinese, and Myanmar. So next slide, please. So it's a very simple mobile application. So it actually have just 2 features. The first thing that you have to do after you download the application, when you get to the place that's going to be your place of quarantine, you have to check in or like specify the location of your home on the map. And then after that, I just do it for one time at the first time that you open the app. And after that, for 14 days, each day you have to do a self-report of the health condition. We call it the daily screening. So it's going to ask you just a couple of questions about your health to assess your risk of getting COVID-19. The first question is whether you have a fever, what is the temperature, your body temperature, and whether you have the following symptoms cough, sore throat, runny nose, shortness of breath. And then after you fill in the information and you get hit next, the system will assess your health condition and the risk level. And get you some recommendation. If you get the high score is the you are very risk. It will show you the contact number that you can call the call center of the Department of Disease Control, and in some cases also show you the hospital that you have been doing the test previously, and you can call directly from the application. And also, when you connect to the healthcare personnel, they already know your location, and if you need to go to the hospital, they can send the ambulance directly to right away to your home, because the system already know your location. Next slide. So sorry for this slide because the dashboard is in Thai, but I will try to explain it to you. So this is what we call the DDC care dashboard, and only authorized personnel can and see this information because it contain personal information and health information. And on the top is we call it authorization level. If you are healthcare worker working with a hospital, you can only see the information of the patient who are the patient of your hospital. You can't see the information of the patient from other hospital. If you are this sick health person, you can see only the person that quarantined in your district or in your province. You can't see information of other people also. This authorization level, and these are I have a summary of the number of people who have to to the system. And also we do the visualization in the middle that is showing the map. This is the map of Thailand, and each dot is represent the person that have to be home quarantine. And next slide, please. If you click on each dot on the map, you can see more information. So the dot is also representing color that represent the risk level of the people to getting COVID-19. Green is meaning having a low risk, orange is medium risk, and high risk. And when you click on the tracking, you can see the current location of that patient, also the health condition of each patient. And then you can also see the timeline of that patient to see where they go within the 14 days of quarantine. May I have the next slide? So the first one on the top is showing that if you're traveling, you can see do the tracking of the part that the user went through, and the middle one is that if you stay in the quarantine place, you can see the gray circle. Is that that circle have the radius of 50 meters? That is the area that you should be in within from your place of quarantine. If you go out of that circle of 50 meters, the screen will show as the picture on the bottom, as this means that you violate the regulation that you turn off. You go off the place that you have should be quarantined. And actually, the healthcare personnel, healthcare workers who see this. There's a case in the northern province of Thailand that they actually call the patient and also send the officer to the place that they have quarantine to do the warning. If they violate this again, they got fined for violating the regulation. And this is being used in Thailand. Next slide, please. So, and this You can also from the dashboard, you can see the information of the patient in the table. So this one show the health condition of each person for 14 days. So the red and orange mean they have high risk and green at low risk. And on the right hand side of the there's the icon that's showing whether they are being out of home during the day or if they lost contact. For example, if they shut down their phone, then it's going to be gray off. And then when the healthcare worker look at this information, like they can know right away about the patient that they have to monitor. So we have the interview with the officer who actually use the DDC system. And during the interview, we found that this system can help reduce the workload for almost 2/3. So without this, the DDC system have to call each of the patients that they have to monitor one by one to ask them for the health condition, health information, and to check whether they are at home or not. But using the system, they just look at the dashboard and just call a couple of them that haven't reported their health condition yet, that help them reduce the workload quite a lot. Have the next slide, please. Okay, this is timeline of development. So we use about just 1 week to develop the first version of the application. And then we do testing for about 2 weeks. And by the end of March, we launched the system and use with the Bamdadradun Infectious Disease Institute is the first test site that we actually apply the DDC CAS system. And after we have been using the DDC CAS system for about 3 months, and by the end of July, there are 51 hospital and health center that use DDC CAS, and also 18 provincial and district health office that use the DDC CAS to monitor people who are at risk of getting COVID-19. And more than 5,000 people have been monitored using this system. So this is, and it's still in using, but as you know that the number of cases of COVID-19 in Thailand is got reduced. So not many people have to be monitored, but it's going to be used for someone who, if we reopen the country, that letting foreigners get into country, and that's going to be another case that the DDC CAS system will be in use. So that is my presentation today.
Thank you very much, Dr. Ananlada. Another wonderful innovation, and thank you. The next 2 talks, or the final 2 talks, next and final, are from a different perspective. One's on digital transformation during COVID-19 at Thammasat University with Professor Suwan. And I think before Professor Suwan, we're going to have Dr. Tawicha talking about private sector role in digital transformation. So thank you, Pang. And one more, and Dr. Tawicha, please.
Hi all. I just want to share the roles of what's happening or what happened from the private sectors or the enterprise company in helping the COVID situation in Thailand. So next slide, please. What I see that there are probably 3 areas. The first one is definitely the collaboration from the private sector with the government agency to launch initiative or application to help flatten or to stop the spreading of the COVID. And the second area is pretty straightforward, that most of the companies or most of the business here in Thailand, we try to comply with all the preventive measure using all the available technology. And the last thing is a little bit, I would say, debatable if it actually helped the COVID situation, but they also claim that the innovation or the idea also helped in the COVID situation as well in the aspect of reducing the economic impact as a consequence from the COVID-19. So I'm just sharing what's going on in what happened in Thailand. Okay, next slide, please. In the early day, I think it's going back in February or March, when the COVID-19 getting serious in Thailand. Actually, it's also my surprise as well that there are quite a few applications and initiative launched from the private sector in collaboration with the government agency as well. For example, for this one, there is application developed by the Airport Authority of Thailand, and they add the function for the traveler to register and to share the information when the traveler arrived Thailand. So that's the first thing that we use application to track and to record the information at the border control. Next slide, please. And the next one is the as I mentioned, there were quite a few applications launched since the beginning in the collaboration or by the private sector by themselves as well. And most of the application, most of the service are designed to monitor or to track the people or the situation of COVID. For example, like we got the application called Moshana, we got the service called COVID-19 tracker to track the movement from the news in the media where the COVID start spreading or where might be the critical point that we should be avoid. And there were, I don't know how many applications were launched, but there were quite a few with similar and with interesting capabilities to help monitor and to track and to share information to the public and to help the government agency to manage the situation. Okay, next slide, please. And there's another angle from the private sector as well. Like for this one, is the application developed by a very big telecom company in Thailand. They develop application to support special unit we call OSMO. Is a unit to work closely with the people in the neighborhood to support, to track, to share information, and to report the situation to the government agency as well. So we got the application that were launched to control, to track, to monitor, and to support the government operation since the beginning of the virus, since the COVID-19 getting serious in Thailand. Next slide, please. And today, it's very common in Thailand when you enter the building or when you go into any facility that you see a thermal and face mask scans and all kind of procedure to advise you to download the application or follow the procedure to help prevent the spreading of the COVID or to at least get everybody aware that we still need to manage the situation. So you see a lot of thermal camera with a mass scan, a face mask scan, or even the TV screens that showing the temperature of people coming in and out of buildings. So it's very usual in Thailand nowadays. Next slide, please. And in the previous presentation, that we're talking about innovation. Yeah, we see a lot of innovation, not just only in the laboratory, but also in the real business operation as well. So like for this one, there's a shopping mall. They're working with again telco company and using the robot to patrol and to give the warning greeting message when they detect that if the people are not wearing masks. So this is an example of innovation. Next, please. And the last areas that I mentioned is I will let you decide if this innovation or this idea actually helping the COVID or not. But what they claim, and even what I see myself, is that essentially, even though this innovation or the idea of using technology not directly prevent or helping the COVID situation, but it actually another aspect that we could apply or could adopt the technology to minimize or to help the business that affected by the COVID-19 situation. So this one is actually the idea to using technology to help the business supporting the operation in retail shop. Actually, this is one from one of the largest bank in Thailand, Kasikorn Bank. They came up with the idea that, okay, with the new normal experience in cafe or in restaurant, we will be contactless. So the bank, in addition to running the bank financial business, they're now providing the technology to help the SME, to help the business can continue running the business and surviving in the COVID-19 situation. The next one, please. And this also an idea launch from bank as well. This is also one of the largest bank in Thailand, called Siam Commercial Bank. The way they look at it is they develop a platform, the food delivery platform, similar to Uber Eats, Instacart. But what they do is that they develop this platform and provide it with very low fee, or they claim actually zero fee to all the restaurant owner. So they don't have, so the restaurant owner can run the business with lower cost instead of paying for the food delivery platform that charge his restaurant 30 or 35%. So the way they look at it is they provide this to help the business continue running their business during the COVID as well. But again, this is an example, and I let you decide if this actually consider as a tool or technology to help the COVID situation. Okay, the last slide. I think from the way I see it, and what I like to share as a role of private sector in helping the COVID situation is we see the speed of change, we see the force of nature that we have to think out of the box, and we need to be able to quickly apply or find the innovative way to continue running a business and helping, actually not just only to help ourselves, but to help the society as well. Because otherwise we cannot survive or we cannot get through this situation. That will be all for me. Thank you.
Thank you very much, Dr. Tawicha, for a really interesting presentation. And then our last presentation, from multiple perspectives in Thailand. We had the innovation perspective from the Thai government and NASDA, NECTEC, the private sector, and lastly, digital transformation and education with Professor Suwan. So Professor Suwan, please.
Hello, everybody. So as I was running a little bit late because I have another meeting, but it's done now. So pretty much today what I'm talking about is that when we as a community move on to the digital platform to do the teaching and learning, and it did not turn out to be what we expected. So there are a variety of problems, but I can sum up into like 3 main causes of the problem. But then we can move on to how to minimize, or how to improve the situation for our next incoming disaster, just like the COVID virus. So let's move on to the page 1. The next page, please. Well, pretty much, when we are talking about e-learning, we talk digital learning and online learning, that we are going to apply, all the principle, the tools, the computer technology to help students learn to the tough times. I mean, the time that COVID has been spread out all over the world. So we have some kind of fantasy that we're going to have some kind of the best learning experience. So everybody think about, best learning experience supported by the technology, but in fact, it just don't really, it did not turn out to be what we expected. So the next slide, please. The first one, because the interaction between the students and the teachers are really limited. So the best way to learn is the students are to looking for the knowledge. I mean, looking for information for themselves all over the internet. But the bad thing is that there are lots of content about the subjects, all the subjects, but the contents, it has some kind of unique characteristic. For example, it may be found in forms of blogs or personal journal or something. It could not be utilized as teaching material, learning material, because it lacks of the evidence, right? That is the first one. The second one is, well, there are a lot of trusted with the credibility. I mean, it is a content in English, but Thai people, I mean, Thai students could not have an access to the kind of knowledge because we are lack of the serious skills in order to get access to that kind of knowledge. So even though there are lots of knowledge out there in English, but we just could not make use of it. So finally, ultimately we just turn into the Thai, the knowledge that written in Thai. So this response to the concern that I brought up, which is the limited online resources. I mean in local language. And next slide, please. Let's say that we move on. I mean, we just overcome the first problem, which is the limited knowledge and limited resources. Now we move on to the platform. We try to migrate, all the knowledge that we have ever had, offline to the online world. But there are certain protocols, there are certain practice that couldn't be carried, onto the platform. What I found is that the teacher, the instructor, they did not adjust the content to be able to digest it easily on the online platform. They just use the same set of knowledge, the same form, the same approach, that they have been they have been doing the offline world for some time, and then they try to perform the same thing over the online world, which is there are a lot of limitation and conditions regarding the space and the place and the synchronization of time. So the teacher could not do better if they put more effort into modify, to adjust the content that they already have to be more like useful and suitable for online learning, something like that. So the teacher had to be more let's say more attentive to the content, and they have to have certain set of customization practice to apply certain technique to facilitate the learning online, which can like produce the same result as what they have done offline. And next slide, please, the first one. Well, I think this is when we hit the hardest. Well, we have never been tested the system before. For example, in the primary school or secondary school, they have a lot of content, in the tape, in the videos, but they never test it. It's just out there in the inventory system. This is out there in the computer, in the hard drive. But when the times come that they have to use it and they use it, they found a lot of mistake, a lot of condition, a lot of let's say obstacle in order to deliver the content to the student. I would like to talk about some. I think you might have been in the same place with me. When we're trying to use some kind of the software, for example, the WebEx, the Zoom, the Microsoft Team, the communication late. I mean the data transfer is kind of lag. If you have 10 people in the group, 9 of them they have like super fast but only one person out there that has like really slow internet. The communication rate, I mean the data transmission rate going to adjust to the slowest one, and it could it could like impede the learning process, impede the pace of the studies, the learning on the way, and I think the problem is it's more like we maybe have some kind of the disaster recovery plan or something, because we just so sure that no such thing will never happen to us. I mean the outbreak, and we have never tested the system. Actually, we don't have the plan yet. So I would like to escalate. Why well to escalate this issue is a national issue. So it's not just about about the having the let's say the backup site, but it's just for the national security in general, not apply only specific on this kind of system environment. I mean the learning environment. Let's move on to the next one, please. So, well, I think the very concept of what has been here. I mean, what's been happening out here is that we just cannot deny that now we are still experiencing this kind of the concept. I mean, the digital divide. I think that the problem has been recognized in the, let's say, the underdeveloped world. I mean, the third world countries. But in the first world country, I think that the problem could be really minimal, right? Because the infrastructure and the social equality and the distribution of resources have been effectively equal. But for the country with certain political infrastructure that the resource couldn't be distributed evenly, the event of the outbreak could make the situation more worse. I mean, it has been polarized between the two groups of the population out here. Like the first group is that in the upper middle class, they just enjoy social infrastructure that they have built. But for the privileges, they just have nothing. They have no tools, in order to gain access to certain service, to certain knowledge, to the learnings, to the school or to the online learning whatsoever. So I would say the outbreak that has come to us right now is kind of a reminder. It's a wake-up call that we lack of the let's say the plan, the contingency plan, to move our society along. Let's move to the next slide, please. So, this is the long-lasting consequence that has been, out there already in Thailand right now because of the outbreak. The first issue is that the outbreak, is just reveal, all the let's say the review all the problem that we try to cover in terms of political power, the balance of power, the problem of the infrastructure readiness, and it just go right to attacking the poor. I mean the have not, the underprivileged. And the second one is that, well, because of the teacher, they don't have enough resources, to do the job. They have to invent their own private solution, and this kind of solution that hasn't been written yet. So they kind of come up with any creative kind of thing, that try to overcome the problem of communication and the absence of the classroom. So some of them apply certain technique that is not really has been it's not. I mean, the technique hasn't been well studied yet. So it could raise some kind of alert on the kind of practice. And the last one is that because of we don't have the plan, the plan to cope with. I mean, the plan to cope with the virus or the disaster. The teacher, for example, I myself, I have to invent my own solution. I bought my own hardware, then I install the software based on my base knowledge. And I have been working on it for a couple of weeks, and it doesn't work. It did not work because the hardware, the software, they did not work together. And you know what? The camera, I mean, the web camera is so expensive here in Thailand. I thought it was for 1,000 baht, I guess. But when they asked for a high quality one, I was surprised that it's like 5,000 baht. It's 5 times, more expensive than what I expected. So the kinds of the expenses, the cost that the teacher have to shoulder, that have to absorb on their own. And next one, please. Next slide, please. Yeah, this one. I think the main reason why we don't have the plan to cope with the disaster, because the people on the upper end, they just think that they are well-to-do. They don't have to care about anything. So in tough time, they could just leave the situation and be out there somewhere out there in the world. They don't have to get stuck with the situation in the country anymore. So they just not really try to push to drive the safe, let's say the plan, the safe plan, the contingency plan to deal with the disaster. or with the some kind of uprising right or something. And I would say that the problem that with the education in Thailand is just a tip of the iceberg, because it has been really contextualized, you know, with the political aspect, with the practice. I mean, with the culture for a long time. For example, for almost like 500 years, and in order to better understanding, you know, what we have done and what we should have done, I think we need to get back to the essence of the whole thing. Is that we need to distribute, you know, the resource. For example, the knowledge, the certain knowledge that can keep us alive, can keep up, you know, up and running, and rebuild our community after the COVID virus. I think the most easy one, the easiest one to do is that we need to surrender certain perspective, which is dangerous. I mean, the perspective is that, you know, in Thailand we have told that, you know, we are rich of resources and opportunity, and the resources and opportunity never run out. So we have to be more cautious about the resource, about the way that we use the resource and the power, and turn the power to resource, the resource to the power. That's all.
Thank you very much, Professor Suwan.
Thank you.
We have several questions, two from Dr. Rolson and Dr. Chotimongkol from Madagascar in regard to digital education. And one you talked some about a little bit, the ICT. And some other questions is, for very remote areas with limited ICT coverage, how did education adapt? And then our second question was, prior to COVID, what was the university's view of online education? Or was there quite a bit of it before COVID, or not too much?
All right. Well, I'd like to respond to the first question. Is that what did they do? I mean, in the remote area. So what they found is that they the teacher got to be the leader. Usually they just formed, you know, some kind of learning group themselves, get together in order to share the resource. For example, they share like a computer, they share like a television set, you know. It's a lot easier, you know, to distribute all the resources. I mean, the ICT, you know, tools, or the tablets, or the smartphone to everybody. The best way, easiest way is that to come to Suwan as a group, a learning group. For in higher education, I think in higher education we kind of creative in a way. For example, we try to let's say modify, you know, the learning objective. Some in certain lesson or in certain content we have to do heavy or lecture. So we just change it from doing the lecture to the workshop. The people can the student can just work on themselves and then evaluate, you know, using the video conference, you know, as a group, and come up with the comment and the grading, some kind of thing. So I would say for higher education, we have a lot of let's say freedom, you know, to change and to modify it to be easy for the learner and the teacher. I mean, the learner and the instructors.
Thank you, Professor Suwan. With that, I'd like to ask each of our speakers to please make a brief closing comment, and we'll go in the order that everyone spoke with. So Director Wantanee, would you please make a closing comment?
Pardon?
Oh, would you please make some closing remarks?
Okay. Okay. Thank you for all the participants that come to our seminar. This is the first time that we are doing the webinar that share our experience in COVID-19 to other countries. Hope that our experience will be using as a use case in many countries. Thank you very much. Yeah.
Thank you, Director Wantanee. Dr. Sarun, do you have a closing remark?
Yeah, first of all, thank you very much for hosting this webinar. And again, I think COVID made us united, and COVID-19 made us to see that we have the same goal to help people and to develop some prototypes using the current technology and make it workable. I think this is very important during this time. Thank you very much.
Thank you, Dr. Sarun. Dr. Ananlada?
So thank you very much. Thank you, the host, and thank you all the participants. So similar to Dr. Slan, that I think the COVID-19 is was a risk and also create the opportunity for all the researchers to put together the innovation that earlier we may have it all, only on the lab, but we have a chance to put it together and have it the solution that actually solve the real problem. So this is also the opportunity for the to drive the technology forward. So
Thank you. Dr. Tawicha?
Hi, thank you for everyone and your time. I think the most important thing is we don't know how long this situation gonna last. So I think we have to be strong and fight together.
Thank you. And Professor Suwan?
First of all, I would like to thank you all for the opportunity for having the kind of a webinar here, and it's good. Well, for me, I think the COVID-19 is the turn of the humanity. So it exposed us to the to the problem that we have never seen before, and it's also exposed us to the opportunity that we have never seen before as well. So I hope that sometime we will be able to make use of what we have seen, what we have learned during this period. I mean, this whole time the COVID virus has been spreading out. Thank you.
Thank you, Professor Suwan, and thank you, Director Wantanee, Sarun, Ananlada, Tawicha, and Professor Suwan. Also, I'd like to thank Pornprama Titanon from NSTDA, who organized or helped organize the event and coordinated much of the participation, and also Professor and Associate Provost Jirapan Sunkpo from Thammasat University, and thanks to Pung Warwig for support on the technology side. And thank all of you for joining. Our next two, and learning about the experience of Thailand, our next two is going to be with Asian Development Bank and a pan-Asiatic look on developing countries, and then Korea with National Information Society Agency. So thank you very much for joining, and thank you to all the wonderful speakers.
Thank you.
Thank you very much.
Okay, thank you. Thank you.
Thank you.